There are plenty of times that you can take notes. Write on the turn cards from the gowns. If I needed to, I would write little notes and then take a picture of it afterwards if I needed to, just so I wouldn't forget anything. I'll lay in bed at night after a day's work and I take out my phone and I have a bunch of notes in my phone, specifics for each surgeon, starting with medication needed, the bed needed in the room, what position, exactly what positioning equipment I need, and in what place, if they're taping something, where the bump goes exactly, how low they want the patient on the bed, if they want a 10-15 with their tourniquet, exact instruments needed during the case for retraction and whatnot, and then at the end, whatever sutures they like to close with, including what type of closure they want, and afterwards what dressing they would need, and if it's an ortho case and we're putting plates and screws on, doing an ORAF of something, then are they splinting? What kind of splint do they need? How do they like it? I go into a lot of detail when it comes to my notes. In the beginning, I think it's a lot more difficult because you don't fully understand the procedures and what's happening. So it's just important for you to write down what you remember, and then the next time that you work with them, you already have some written down, and so something else will come to mind that you can write down. But that is if you are willing to take your job very seriously and try to become the best that you can. And sometimes it takes you being at home and being able to decompress before all those thoughts come back and you remember the steps or whatever. They're your notes. You're not writing notes, so I understand them. I'm not writing notes so that you understand them. You need to write your notes so that you understand what you're writing down and put all the information that you need into whatever detail you need to put so that you can remember. That's what I do.